When we talk about pain, अक्सर हम इसको काफी lightly ले लेते हैं कि मुझे दर्द है, right? लेकिन what is pain actually?
Now the pain is now considered to be the fifth vital sign. Up to 95% of people coming with chronic back pain have non-specific back pain. Or same is true with any part of the body. And among those 5% of the people which has the underlying cause, you'll be surprised to know that only 1% will need a surgical intervention. For that 1% of patient, you cannot keep 99% of the population as hostage. Like psychologically, they will be told that no, you have a disc and you have to undergo surgery.
Geriatric patients होते हैं या कहीं कोई trauma हुआ होता है, so people complain of pain. As you rightly pointed out कि नहीं पता होता कहाँ दर्द actually उठ रहा है.
You cannot keep a patient on painkiller for neuropathic pain. It is not going to help. It is going to cause nephropathies, kidney problems, stomach problems, and your pain is not going to have any effect for these NSAIDs. So somebody with chronic pain has to get his pain managed in the same way as a diabetic patient manages his diabetes. Pain can be as simple as a muscle spasm. It can be as complicated as an infection of the spine, which can be tuberculosis, which can be infection, which can be tumor.
You are having chronic pain. क्या ऐसा भी होता है कि इंसानों का जो पेन थ्रेशोल्ड है वो बढ़ जाता है and they tend to take it very lightly then?
ये देखा गया है कि औरतों में पेन थ्रेशोल्ड कम है. इसीलिए आप देखोगे उनको कॉम्प्लिकेशंस बहुत कम होती है. द पेशेंट इज एक्सप्लेनिंग द पेन व्हिच मेक्स नो सेंस, लाइक it's all over the body. Okay. From head to toe. Okay, basically you have to evaluate psychological aspects of the pain.
Cold can be very tricky. It can help you in managing your pain and it can aggravate it also.
Absolutely. The cold is a double-edged sword.
तो देखने वालों को मेरा सलाम, मैं नासिर हूँ और here we are again with a very important conversation today. और आज जिस बारे में हम बात करने वाले हैं इसके बारे में we speak a lot about. और हम जब किसी मेडिकल प्रैक्टिशनर के पास जाते हैं तो शायद सबसे पहली जो कंप्लेन होती है वो यही होती है कि दर्द हो रही है और या दर्द हो रहा है, कैसे इसे ठीक किया जाए. Right, and we have with us Dr. Tariq Trumbu. Dr. Tariq is an internationally renowned pain specialist. बहुत बहुत शुक्रिया सर. Thank you so much for being here with us. और पेन एक ऐसा सब्जेक्ट है, जब हम ऑफ द रिकॉर्ड आपसे बात कर रहे थे तो I was like आपने ऐसी ऐसी चीज़ें बताई, लाइक वो जहन खुल जाता है ना एक प्रोफेशनल के साथ बात करके कि कितना वास्ट है ये सब्जेक्ट. और इट इज़ नॉट जस्ट अबाउट फीलिंग पेन एट अ सर्टेन प्लेस इन योर बॉडी. इट्स क्यों है, कैसे हुई. इट्स अ वेरी बिग सब्जेक्ट. सो पहला सवाल मेरा आपसे यही होगा कि व्हेन वी टॉक अबाउट पेन, अक्सर हम इसको काफ़ी लाइटली ले लेते हैं कि मुझे दर्द है, राइट? लेकिन what is pain actually?
First of all, Nasir, thank you for calling me here. And the question you asked, what is pain? The definition of pain has been changing after every 5 to 6 years. And now it's on the records, like now the pain is now considered to be the fifth vital sign. Okay. When you go to a doctor in an emergency, they will check your breathing, they will check your pulse, they will check your blood pressure. Now it is mandatory that they will have to ask you about pain. And pain is an response to any external injury or internal injury. It's a response to the injury or a stimuli. Till now, we have been learning in our medical colleges, in our teaching, that pain is a response to an harmful stimuli. Okay? But now, it will be in your mind, like suppose I pinch you on the skin. So here the external stimuli will be my pinch.
Okay.
So what is the treatment? If I ask you, what is the treatment here?
Getting rid of that pinch.
So, yeah, release the pinch.
Yeah.
It will not be like give a pain medication to relieve your pain while the pinch is still there. So it's a common understanding. So what we think till now, what we have been taught till now, that underlying cause, remove the pinch and pain will be okay. But you'll be surprised to know, suppose a patient comes with a back pain. Okay. In 90 to 95% of patients, the pinch doesn't exist. So in 90 to 95% of times, there is no underlying cause. The pain is just non-specific.
पता ही नहीं है कहाँ हो रहा है.
Yeah, it's non-specific. Up to 95% of people coming with chronic back pain have non-specific back pain. Same is true with any part of the body. Okay. Now, identifying the 5% of the people who really have the underlying cause, you have to undergo a array of investigations, lab investigations, scans, MRIs, CT scans to know the underlying cause of the pain. Okay. But if the patient goes directly to the doctor who deals with chronic pain, he might not have to go under such an investigations, okay, to come to the conclusion that you are not among the 5% of the patients. You belong to the 95% of the patients where the underlying cause will not be there. Okay. But having said that, suppose a patient goes to an pain specialist, okay, to come to the conclusion that you fall among the 95% of the patients where there will not be any significant underlying cause, we will have our own method of diagnosis, like which includes diagnostic blocks, which includes history, background checks, psychological evaluations. Okay. And if we find that there is an underlying cause, and among those 5% of the people which has the underlying cause, you'll be surprised to know that only 1% will need a surgical intervention. Okay. Now, you'll be surprised to know that, for example, you go for an MRI scan, and MRI will show you that there is a nerve compression at L5, S1 or L4, 5. But if you take randomly your friend who never had a back pain to get an MRI scan done, most likely he will also have the disc bulge or disc protrusion at multiple levels. That doesn't mean that a scan isn't guarantee that you have
to
a
identify
problem.
your pain, right?
Yeah. It's again, I want to add here that there are so many things in spine in those 5% of the patients who complain of back pain, who have an underlying cause. You'll be surprised to know that disc is one of the factors.
Okay.
There are so many things, like there are small facet joints which can contribute up to 40 to 45% of the back pain. Sacroiliac joint inflammations, muscle strains, tendinitis. Okay, there is something like nerve entrapments, like cluneal nerve can cause pain. And there's a muscle in the hip, around your hip, which is known as piriformis muscle. It can go into spasm and cause a sciatica-like picture. And you go for a scan, and it shows a disc. And sometimes you get wrongly operated for the disc, whereas the cause is something else.
Yeah.
Okay, so it's a disaster. It's a medical disaster. And the volume of patients whom we call as failed back surgery syndrome gets accumulating in our society. And then the wrong notion is given to, like, back pain surgeries do not work. Actually, they work, but it is a selection.
Underlying factor is something else.
Yeah, and it is a selection of the patients. So our role is, suppose a patient of back pain or sciatica comes to us. And here I want to add something, that majority of the discs, herniations and nerve compressions, which you call as sciatica, majority of them are destined to heal of its own. Within 6 months or 1 year, your disc is going to get reabsorbed of its own. In majority of the cases, not in all the cases. Okay, and 1% of the patient who progress towards progressive neurological deficit, which we call as red flag signs. Okay, they will need surgery. They will need surgery. But for that 1% of patient, you cannot keep 99% of the population as hostage. Like psychologically, they will be told that, no, you have a disc and you have to undergo surgery. It's not the case.
सो दर्द की जब हम बात करते हैं तो काफ़ी एक वास्ट एरिया है। आपने कहा कि आइडेंटिफिकेशन इज़ वेरी इंपॉर्टेंट एंड मोस्ट ऑफ द टाइम्स नहीं पता होता है कि दर्द उभर कहाँ से रहा है।
Absolutely.
सो ऐसे पेशेंट्स क्या करें? लाइक व्हेन वी टॉक अबाउट पेन, खासकर हम अक्सर सुनते रहते हैं जो जीरियाट्रिक पेशेंट्स होते हैं या कहीं कोई ट्रॉमा हुआ होता है, तो पीपल कंप्लेन ऑफ पेन। एज़ यू राइटली पॉइंटेड आउट कि नहीं पता होता कहाँ दर्द एक्चुअली उठ रहा है। क्या कहेंगे इसके बारे में?
अभी मैं आपको इसके एक बहुत इंटरेस्टिंग पूछा आपने। बेसिकली पेन के भी बहुत टाइप्स है। इसमें बेसिकली वी कैन कैटेगराइज पेन लाइक न्यूरोपैथिक और मस्कुलोस्केलेटल।
जी।
ओके, न्यूरोपैथिक में it is again categorized into many subsets, like centrally sensitized, mononeuropathies, polyneuropathy, okay, widespread pain syndrome, fibromyalgias, okay, and stress-induced pain, psychogenic pain. So there is different medication for different types of pain.
Okay.
You cannot keep a patient on painkiller just like NCID, just like diclofenac sodiums and all those things for neuropathic pain. It is not going to help. It is going to cause nephropathies, kidney problems, stomach problems, and your pain is not going to have any effect for these NCIDs. Yeah, it might stop for a day or two only to come back. Okay, so identifying the type of pain and giving the proper medication for that pain. Because if it is a neuropathic pain, you have to address the nervous system. Okay, for example, people might be knowing this time pregabalins, gabapentins, or many other things for neuropathies. So the subset of medication differs, and when to stop, where to stop, and the appropriate dosage, that is our subject.
तो डॉक्टर साहब, एक सवाल जो मैं पूछूंगा आपसे वो ये है कि हम जब दर्द की बात करते हैं तो कैसे एक पेशेंट को पता चले, आई मीन हाउ डज ही और शी नो कि दर्द एक स्पेसिफिक एरिया में है बिकॉज ऑफ अ स्पेसिफिक रीजन, एंड इट कैन बी एनीथिंग एज यू सेड, मे बी योर ट्रॉमा, मे बी साइकोलॉजिकल, मे बी बिकॉज ऑफ स्ट्रेस। क्या ट्रिगर फैक्टर्स हैं और आइडेंटिफायर्स क्या हैं?
Basically, there comes the role of a pain physician. We can specifically locate the cause of pain by giving a local nerve blocks or muscle blocks under image guidance, where we can come to know that your pain is not due to some nerve entrapment, it is not due to any joint, it's not due to any it's like myofascial, it's non-specific. Okay, or we can sometimes even give a nerve root block, to exactly know if the patient is going to be benefited by any intervention. Okay, because sometimes what happens is, yeah, there is an pain at L5 as one disc is compressing on the nerve, but the damage has been done.
Okay,
now the damage, like a foot drop, weakness in the foot, has been done by the nerve compression. In this stage, you have to explain to the patient, now even if he undergoes surgery, it's least likely that his problems in neurodeficit is going to recover. Okay, so what will he do now? He will tell the doctor, okay, if my neurodeficit is not going to recover, I need to manage my pain. So then you have to mix your nerve blocks with the proper medication and keep him comfortable till the underlying cause, whatever it was, recovers of its own. And majority of times, some patient, you talked about geriatric patients, sometimes they have osteoarthritis knee. Okay, they have osteoarthritis of any joint. Okay, now the treatment is go for a knee replacement surgery. he is not agreeing for knee replacement surgery because of underlying medical conditions, or he simply is not agreeing. Okay, now our role is we just burn the nerve supply of the knee by radiofrequency ablation. It's a very safe and effective procedure. He'll be pain free for years together. If lucky, it can exceed to 2 years, 3 years, which can be repeated again. Okay, yeah, it might not work for grade 4, grade 3, 4 osteoarthritis, but in majority of the patients it will help. Okay, and a patient is going to a doctor, knee specialist, and he gives him only one option, that is knee replacement. He is not ready, and what is his option? He has to take painkillers for life. And before he goes thinks of doing now our procedure, his kidneys are gone because of painkillers. So earlier intervention is the must.
Yes. So एक सवाल जो है कि when should a patient know कि it is the right time to address the pain which is happening?
Okay.
Because अक्सर ऐसा होता है ना कि दर्द होता रहता है, हम बर्दाश्त करते हैं, दवाइयाँ खाते हैं. खैर वो तो एक अलग सवाल है, मैं आपसे पूछूंगा कि what is the adverse effect of painkillers which people have left, right and center. इसके बारे में आप क्या कहेंगे कि when is the right time? कब एक पेशेंट को पता चले कि the pain is prolonged now this is the right time that I should see a pain specialist?
Okay, what happens is, like, if suppose if you have pain, okay, if you have muscle spasm, if you have neck pain or back pain, majority of the back pain should improve within 2 or 3 weeks. Okay, you don't need to go to the doctor. It will improve irrespective of your medication. This is a very important point I am telling you. अगर तुम दवाई खाओ या ना खाओ, तुम्हारा बैक पेन 2-3 हफ्ते में ठीक होने वाला है.
Okay, that's very important.
हाँ, ठीक है. और इस ड्यूरिंग दिस पीरियड, इस दौरान अगर आप बेड रेस्ट करोगे तो आपका पेन जल्दी ठीक नहीं होने वाला है. यू आर प्रोलॉन्गिंग योर बैक पेन.
ओके,
बिकॉज आपके मसल्स वीक होने वाले हैं. बेड रेस्ट का जो ऑप्शन है वो बहुत पुराना हो चुका है. इट हैज बीन डिस्कार्डेड.
ओके,
वी आर टॉकिंग बैक पेन दिस टाइम. बैक पेन है, कीप मूविंग. You can take a rest for a day or 2, but not more than that. Okay. So if it is not okay in 2 to 3 weeks time, or your neck pain, the same thing, you can take anti-inflammatory medication or the counter, any medication for pain for 2 or 3 days. But if it is not becoming okay, or you are not getting relieved, it's the time to see a pain specialist or any doctor, because your pain, if not treated adequately on time, can become chronic.
Okay.
And once it becomes chronic, keep it in mind, in some cases it is not going to go away. Then comes our role of pain management. So somebody with chronic pain has to get his pain managed in the same way as a diabetic patient manages his diabetes. Okay, as in hypertensive patients manages hypertension. So it is so important to get a proper pain management with the proper medication, which includes some interventional nerve blocks to keep you pain free. If you are not pain free, keep it in mind that it is as harmful as any chronic disease. Okay. So addressing the pain as quickly as possible is very important. But give a time of self-healing. Like there is a muscle spasm, or there is a back pain or neck pain, give it a time, 1 week, 2 week, 3 week, but not more than that. Because if the pain is not going away, we need to look into it. Because back pain can be as simple as a muscle spasm. It can be as complicated as an infection of the spine, which can be tuberculosis, which can be infection, which can be tumor, which can be anything. Like, we should not waste more time.
So this is very important जो आपने कहा. लेकिन क्या डॉक्टर साहब, अगर you are having chronic pain, क्या ऐसा भी होता है कि इंसानों का जो पेन थ्रेशोल्ड है वो बढ़ जाता है and they tend to take it very lightly then?
See, पेन थ्रेशोल्ड बढ़ना ये सब्जेक्टिव है. ये बेसिकली कुछ रेसेस ऐसे हैं वर्ल्ड में जिनका पेन थ्रेशोल्ड ज्यादा है.
जी।
और ये देखा गया है कि औरतों में पेन थ्रेशोल्ड कम है,
ओके।
इसीलिए आप देखोगे उनको कॉम्प्लिकेशंस बहुत कम होती है। सपोज गाल ब्लैडर की पेन है, ये जो मेल है ये थोड़ा डिले करता है सर्जरी को, क्योंकि अपनी अपनी पेन को ही ज़्यादा टाइम छुपाता है। तो फीमेल्स गेट ऑपरेटेड क्विकली, तो
Yes.
उनको कॉम्प्लिकेशंस कम होती है। सो ये पेन थ्रेशोल्ड की बात आ गई।
जी।
ठीक है, जो ये मेल है, मर्द है, इन बेचारों को ही ज़्यादा क्रॉनिक पेन होती है, बिकॉज दे कीप ऑन सप्रेसिंग द पेन at the cost of this pain. What it does, it doesn't go away, it makes a space in your brain,
ओके।
which we call as central sensitization. Once central sensitization happens, the pain is not going to away. It's like a tape recorder inside your brain, which is going on rewinding even if the underlying cause is gone. Okay, sometimes we call it as chronic complex regional pain syndromes. Even a pinprick can cause CRPS, complex regional pain syndrome, and there is no cure for that. Okay, I will give a very good example here, that is post-herpetic neuralgia. या कश्मीर पर मलदर वनान छ। Okay, मलदर द्राव छ गसान डॉक्टरस to treat मलदर। Okay, so डॉक्टर छ करान prescribe antiviral, मगर most of the time छुन सु तम सु pain address करान की। अगर नहीं मलदर पेन राइट टाइम्स पर एड्रेस करना, some subset of patients will go into PHN, post herpetic neuralgia yathis wanan छ।
ओके।
And keep in mind, post herpetic neuralgia in many cases is not curable, it will be there for life. This is the importance of treating pain on the right time.
So psychology plays a very important role here.
Psychology means yeah, there is a psychological component for pain, which we call as psychogenic pain.
Yes.
To identify a psychogenic pain, you have to give time with the patient, which is not there.
So अभी जो मैं आपसे सवाल पूछ रहा था वो ये था कि हम जब बात कर रहे थे ऑफ द रिकॉर्ड, आपने कहा कि बचपन का कोई अगर ऐसा इंसिडेंट हो या कोई स्ट्रेस फैक्टर हो, तो ये अंडरलाइनिंग फैक्टर रहता है पेन अकरेंस में, इसके बारे में बताइए।
Absolutely, such patients are very common in subcontinent,
ओके।
especially in Kashmir. Okay, कभी ऐसा होता है कि बचपन में कोई ट्रॉमा हुआ तो जिसको हम PTSD भी कहेंगे, पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर्स, वो भूल भी गया होता है, लेकिन उसने एक अपनी जगह बनाई होती है।
ओके।
ओके, दैट कैन मैनिफेस्ट इन पेन। या कभी कोई ऐसी कोई औरत है जिसकी शादी किसी घर में हुई हो और अंदर का एनवायरनमेंट उसको सूट नहीं कर रहा है और शी इज अंडर स्ट्रेस, शी कैन नॉट मैनिफेस्ट, शी मैनिफेस्ट एज पेन।
Okay.
Okay, she
So
manifests
stress
as pain.
comes out as pain, right?
Absolutely, because it can manifest as depression, or it can manifest as pain. So like widespread pain syndrome.
So you see patients like that?
Of course, and you are not able to. It makes no sense. The patient is explaining the pain, which makes no sense. Like it's all over the body.
Okay.
From head to toe. Okay, basically you have to evaluate psychological aspects of the pain. Okay, and I think if you ask me for the treatment, really speaking, like I have seen patients internationally, like there is no cure for such things. Only there is only one antidote for these things, that is happiness. Happiness is the antidote.
यही सवाल मैं आपसे पूछ रहा था कि how important is the kind of people you interact with when it comes to such pains, or the surroundings you are in. That also helps, right?
See, like I will tell you something. The company you are in matters a lot.
Okay.
Because stress, depression is contagious. Depression, stress छु तिथा पट लारान तिथा पट ज़ाज़ ज़ुकाम छु लारान आके किस. अगर फैमिली मज कुन कान नफर डिप्रेस ओस, अगर न तुई सु वापस अनियोन तो आई थिंक डिप्रेशन. Okay, so these things manifest in different forms. It makes your family life miserable. Okay, because it's very important to be normal.
Yes.
But being normal is not so common. एक member भी family में थोड़ा normal नहीं रहा ना तो हर family is dysfunctional. Okay, why I'm telling you these things? Because I have seen some patients who come complaining of these pains, widespread pain syndromes, and all those things. And then when I ask them, when you go to other place or when you are busy, do you have the same pain there? They say no, we don't have some pain there. That means the environmental factor.
That's a trigger.
That's a trigger. That's why we collectively have come to one conclusion, that the antidote for these myofascial pains and all those things is happiness. Like small worries, like financial worries,
Stress.
or stress, or family issues, and all those things. We have to educate the people, that they should live the life immediately. Okay, they should live the life now. There is no tomorrow.
Okay.
Okay, tomorrow doesn't exist because you have not seen the tomorrow. Past has gone. So what is left is the moment.
Yes.
So enjoy this moment. If you are not able to enjoy the moment, okay, you will not come out of chronic pain. Okay, because you will be always, if your pain has a psychological element, because you will be thinking of tomorrow. Okay, so cognitive therapies, behavioral therapies, psychotherapy, okay, is part of the complete comprehensive pain management.
Absolutely. So, Dr. Saab has said it कि कितना ज़रूरी है to have that kind of an environment around you जहाँ आप stressful ना हो, जहाँ आप खुश रहें. डॉक्टर साहब, now let's come back to winters. हम अक्सर ये सुनते हैं कि तूर छ तो कहीं उस लोग मुझे दाग चितात है ससवार. What is the correlation? Because अभी हम जब off the record बात कर रहे थे, आपने कहा कि cold can be very tricky. It can help you in managing your pain and it can aggravate it also.
Absolutely. See, people who live in cold areas like Sweden, Finland, Norway, they are the happiest people in the world, and they are the most prosperous people in the world. And don't expect that people living in cold areas don't have they are having more pain. It's not like that. Okay, it's the facility they are having.
Yeah.
Okay, the facility is like that, they won't feel cold. But here, due to lack of facilities, you are you are exposed to cold at many occasions. And what happens in joints, ligaments, they get more stiffness during the cold, and your body becomes stiff. The threshold of pain lowers down, so blood supply of small joints, they get altered. Okay, so the pain threshold basically goes down.
Okay.
Okay, but it's not like that. I told you before of the record that the cold is a double-edged sword. If you get any inflammatory pain or any joint pain, a doctor will advise you go for a cold sponge. That will relieve your pain, because what that does, that will reduce the inflammation in the joint.
Okay.
Okay, cold water bath will relieve your pain, body pain. Okay, sometimes it is recommended, because I had just written a document, that your neuropathic pains will increase during the night. If you ask some patient, they will tell, "Asich ratas karan zyada pain." Okay, why? Because जो आपका एंटी इन्फ्लेमेटरी हार्मोन है, वो रात के टाइम कम हो जाता है, यानी कि इन्फ्लेमेटरी लेवल आपकी रात में ज्यादा हो जाती है. So you feel more pain during the night. So what is the remedy? Before you sleep, go for stress-free meditation. 20 minutes before you sleep. Meditation, I talk of for the common public, but for us, the best meditation is Salah Nimaz. Okay, go for 20 minutes of meditation, or you can take a cold shower. Cold shower will help. Okay, it has an anti-inflammatory effect.
So world-renowned जो आजकल athletes हैं, they also take cold showers. It's
Of course, basically what it does, I will tell you something which people will understand. It causes a local vasoconstriction.
okay.
So blood vessels get constricted in your skin. So heat loss gets minimized.
Okay.
You got it? So जो आपका core temperature है, वो अंदर से बढ़ जाएगा, आपका peripheral temperature कम हो जाएगा. Okay, and it's a hormonal stimulant. You'll feel fresh. Okay, the stress levels will go down. So if you keep blaming the cold is a double-edged sword.
Yes.
Locally, it might cause joint pain and all those things, but overall, cold is not that bad.
तो एब्सोल्युटली डॉक्टर साहब, इट इज़ सच अ वास्ट सब्जेक्ट, हमारे पास वक्त की कमी है. आई वांटेड टू टॉक टू यू एंड टॉक टू यू एंड टॉक टू यू अबाउट दिस, बिकॉज दर्द की जब हम बात करते हैं तो इट्स अ वेरी बिग सब्जेक्ट. बिफोर वी साइन ऑफ, क्या आपके पास दिल के दर्द की दवा है कोई?
दिल के दर्द की दवा बेसिकली ये दिल पर मुझे याद आ गया, देयर इज अ term known as broken heart syndrome.
Yes.
Okay.
Yeah.
And broken heart syndrome में सच में people will collapse.
Yes.
Okay, people will collapse out of if they hear some shocking news about anything. About anything. But it can come circling around. It comes to the same point. दिल के दर्द की दवा भी happiness है.
Happiness, yeah. So on that note, Dr. Saab, it was lovely interacting with you.
Thank you very much.
We had a lovely time with you, and of course we'll have you again here. हम और आपसे बात करें और इस पे और हम detailed conversations करें. But before that, one golden advice to people before you sign off.
Be happy, enjoy the moment. Okay, because sadness is the cause of all evils.
एब्सोल्युटली. सो मैं डॉक्टर साहब से भी कह रहा था कि दिल की तन्हाई को आवाज़ बना लेते हैं, दर्द जब हद से गुजरता है तो डॉक्टर तारिक को बुला लेते हैं. ऑन दैट नोट, थैंक यू सो मच फॉर वॉचिंग दिस. बहुत बहुत शुक्रिया. अंटिल नेक्स्ट टाइम, खुदा हाफिज़.
Thank you.